So my patient, Mr. Smith, is a 16-year-old male who presents today for abdominal pain in the ER. He woke up this morning from a nap and had severe kind of right lower quadrant pain that radiated into his testicle. He says it's a sharp, kind of consistent pain that won't let up. He has been kind of nauseous because of it, no vomiting. He has been feeling this pain since this morning. Feels like he can't walk. Feels a need to like kind of crouch and like bend over due to the pain. He says it's progressively kind of getting worse, so they brought him to the ER. He has no significant past medical history, no known drug allergies. He does not take any medications. Family history is just a mom with diabetes and dad with hypertension. He does not smoke. He does not drink. He's in school currently and is sexually active. He says he uses condoms and has had no new sexual partner in the past 6 months. So kind of putting him at a lower risk for STIs. He, for review of systems, he didn't have any vision changes, any hearing changes. He does not have a headache. He is nauseous. He's not vomited. He has no cough, no runny nose. He has no difficulty breathing. He has not had any heart palpitations. He has not had any different sweating. He has not had any burning with urination. He has not had an increase in frequency. No constipation, no diarrhea. He has not had any discharge from his penis. He has not had any itching. He has not had any joint swelling, joint pain. He did not have any night sweats. He did not have any change in neurological function, no new or different anxiety and depression, and no skin changes, redness, or rashes. Vitals were heart rate of 131 and temperature of 102.3, so meeting SIRS criteria, so we went ahead and started blood cultures. Respiratory rate was normal at 17, and his oxygen saturation was at 98%. He had normal blood pressure at 126/72. Strength in all extremities was 5 out of 5. His neurosensation was intact in all extremities and face. He could follow commands. He was alert and oriented ×3. Complaining of kind of belly pain that radiates into his testicle. On physical exam, his testicle was swollen and red. He was positive for McBurney's point, Robsing sign, and Ontrader sign. He was negative for the heel jar test, and positive for SOAS sign. He was tender only to the right lower quadrant and kind of the suprapubic area. Everywhere else on his belly exam was negative. He had regular heart sounds, no murmurs, rubs, or gallops, just tachycardic. He was without any crackles, wheezes, or wails on auscultation of his lungs. And cap refill was good. He had a symmetrical neck, no abnormal swelling. He then went and got labs. So like we said, we did the blood cultures due to meeting SIRS criteria. We went ahead and did a urine on him analysis. We did a CBC, CMP, and a lactate. Our differential included testicular torsion, epididymitis, kidney stone, STIs, cystitis, pyelonephritis, and appendicitis. 2 kind of surgical emergencies would be appendicitis and testicular torsion. Most likely diagnosis were kind of between appendicitis and epididymitis. So his urine analysis was clear, nothing abnormal there. His lipase, we added on the lipase as well for pancreatitis just due to the belly pain, and that was also negative. The CBC showed a left shift, and his white blood cell count was at 22,000, kind of putting him at higher risk for appendicitis on our differential. His CMP was within normal limits, so everything there was normal. His lactic was normal as well. We ordered an ultrasound of his testicles and his appendix. Because he's 16, we kind of talked about how it's preferred to do an ultrasound of the appendix and not go ahead and go to the CT scanner. So we waited for the ultrasound to come back, and with our labs, we're kind of strong, and our physical exam, we're kind of strongly leaning towards appendicitis. The appendix was not visualized on ultrasound, sadly, and the testicles showed epididymitis. So we were going to go ahead and empirically treat for that with DUXI. So for patient education, we talked to the family. I just wanted to let you guys know whether we did an ultrasound, and it did show epididymitis. So we're going to go ahead and put him on Doxy, and we went ahead and started fluids due to his vitals and hopefully bring those down. We also did some Motrin for his fever. The biggest thing is that right now there's 2 surgical emergencies we want to rule out. So one is testicular torsion. It's when the testicle gets kind of twisted and blood supply gets cut off, and so that can become a surgical emergency because the testicle can die. And we want to prevent that at all costs, especially in younger populations. The good news is that the ultrasound ruled that out. He actually has like an inflamed part behind his testicle, but it did show good blood flow, so it's not an emergency. We're just going to treat it with some antibiotics. The big risk we have right now is that he has been positive for physical exam findings for appendicitis. His white count is elevated, which is something we look for in appendicitis. Another thing we look at is the lactate level. It's a kind of an inflammation level, and that we test for in the body, kind of like the white blood cell count, but it tests kind of a different, it's more related to like muscular inflammations, and that was normal, which we normally see elevated. So we're kind of having some signs of, yes, this could be appendicitis, and no, it could not be. Due to its age, we like to defer to the pediatric surgeon for whether or not we want to order this. So we would like to go ahead and start him on ceftriaxone and Flagyl due to his vital signs when he came in and possibility for surgery. And since he already has an IV, we can just go ahead and start that now. We will call the surgeon and come back and update you when he gets back. So the option is kind of to do a CT scan and go to surgery, or the pediatric surgeon just admits you now and probably takes you to surgery in the morning without the CT scan. Our personal preference would be to do the CT scan to see if we have appendicitis. We don't need to go through unnecessary surgery if it's not appendicitis, but we'd love to make it a shared decision-making process, and kind of get the surgeon's input as well. So if you have any questions, I'd love to help kind of answer them or explain anything more.